ignoring or not recognizing their warning symptoms. And of course, always call 911 in the event of an emergency. Next slide, please. So this is a topic that I'm super passionate about. You may have heard of our Go Red for Women campaign, always the first Friday in every February. Heart disease is the #1 killer, taking 1 of 3 women. A woman dies every minute in this country from heart disease. And many times that's because the symptoms for women are very vague. They're often presented as more flu-like symptoms. So we're going to talk a little bit more about recognizing those symptoms and certainly why women need to seek medical attention and put themselves first, right? Women clearly always are great caretakers, but sometimes we forget how important our own needs are and to listen to our bodies when it's sending us this important warning signs. And then of course, sadly now because of COVID, obesity among women is higher than ever. We're not as active, more sedentary and more stressed than ever before on households and on specifically on women in those households. Next slide, please. So heart disease, a little bit about heart disease. So we've got cardiovascular disease, we've got heart failure, we've got heart attacks, and they all present differently, right? So heart disease, as you may know, is a blockage of the vessels, may cause the heart attack, many times because of a weakening of the heart muscle, right? If the blockages are severe enough, they can be treated. So that's why it's so important at early warning signs to get to the doctor, the Dr. Petralis of the world, for the stenting, the ballooning, and other screenings, new treatments, technology, and medications that truly can save your life. Next slide, please. So diabetes, a major health epidemic in this country. And the conditions can definitely be related. We are calling diabetes as a health threat for cardiovascular disease and stroke. Things like elevated blood sugars and the way that they damage our arteries and help those plaques to form. Many people, sadly, with diabetes never have the chest pain and other symptoms because of the damage to their nerve endings. So it's especially important that diabetics not only control their risk, but also make those lifestyle changes that their physician will recommend for them. Next slide, please. Heart failure. More than 5 million people are living with some form of heart failure, and it's the most common reason that people are admitted to a hospital. There's a lot of non-compliant patients with heart failure as well. So some of the reasons for those readmissions, of course, are non-compliance with medication therapies, non-compliance with the diets and the fluid recommendations, and of course, disease progression. Next slide, please. So heart failure is caused by a weakened heart muscle due to heart attacks, heart disease, open heart surgery, valve disease, excessive alcohol consumption, of course, your family history, right? Atrial fibrillation, untreated high blood pressure, which we also call the silent killer. So again, knowing your numbers, you're going to hear more about that in a minute. And then sleep apnea issues. Next slide, please. Stroke is the #4 killer and the #1 disabler in this country. Stroke takes a life every 4 minutes. And it is non-discriminatory. I've worked with people as young as 16 years old that have had a stroke. So much depends upon your family history and other factors like that blood pressure, knowing your blood pressure and knowing how to manage it, understanding what the Heart Association recommended guidelines are for high blood pressure and treatment of high blood pressure with medication therapy, sodium reduction, and knowing the best practices, which is sort of a relatively new concept with us, but definitely knowing that you should have your feet on the floor, an empty bladder, and no talking during a blood pressure screening, all to get the best results, right? Those vessels in the brain become blocked, right? So it's similar to the way a heart attack works, but it's a brain attack essentially as a stroke presents itself. And then, of course, strokes can be directly related to heart disease and blocked arteries. So many heart attack survivors are at a very high risk for stroke and vice versa. Next slide, please. So here are the warning signs of a stroke. You'll have that sudden weakness or numbness of the face, leg, arm, and especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble walking, dizziness, loss of balance and or coordination, and that sudden severe headache, that worst headache you've ever had in your life with no known cause. If you're experiencing any of these symptoms, always call 911 in the event of an emergency. Next slide, please. So how do we reduce our risk? You know, when we talk about these areas that the American Heart and Stroke Association really wants you to think about adopting a healthier lifestyle. This is how we manage our risk, even if you have a strong family history. Our research says that if you are really adamant about adopting a healthy lifestyle, you can overcome that risk too. Watching your weight, right? When we talk about knowing your numbers, your BMI should be less than 25. So what are you doing? Is it diet? Is it exercise? Is it consulting with a physician to determine what a best fit for you is to help you reduce your BMI to 25 or below? Stop smoking. And if you haven't started, don't ever start. And please avoid e-cigarettes, vaping, you know, any chewable tobacco. All of those products put us at a highest risk. And unfortunately, that is one of the easiest ways to control our risk. Avoiding tobacco is the largest contributing factor to living a healthy lifestyle. Reducing stress, easier said than done, right, my friends, especially these last few months. But there are really creative ways that you can manage stress, right? Simple things like yoga, meditation, watching a funny story on TV or a funny commercial, talking to a friend, going for a walk. Those are healthy ways to manage stress. Unhealthy ways are eating that whole tub of ice cream, that whole bag of chips, you know, drinking a lot of alcohol. So being mindful of the way that you manage stress is really important as well. Hear that, you know, blood pressure is again, right? You keep hearing about that, and it is a theme throughout. When we talk about knowing our numbers, having that under 120/80 as being what our recommended guidelines, we really tightened that up about a year or so ago. And it really isn't to put more people on medication. It's really to raise awareness and get people thinking about throwing away that salt shaker, right? Reducing the sodium in your diets, knowing your numbers and how to manage them. If you have to go on blood pressure medication, it's absolutely fine, but staying on your medication as prescribed. Never skip, cut in half, or stop taking your medication unless you talk to your family physician. Knowing your blood pressure is one of the most important things that you can do to, like the knowledge is power thing. It's really, really important here because that blood pressure, that silent killer, oftentimes presents no warning signs. So you could have really high blood pressure and not even know it. A lot of people think there are warning signs related to blood pressure, specifically hypertension and high blood pressure, and that is not true. So that's why knowing your blood pressure, taking it, self-monitoring at home through equipment like Omron, going to your local pharmacy, or seeing your doctor on a regular basis is really important. And then, of course, taking all your medications as prescribed. I'll never forget, years ago, I was at a seminar and this woman raises her hand. I stopped taking my blood pressure meds because I was feeling so great. What? No, the reason you felt so great was because of your blood pressure meds. So always, always, always take your medicines as prescribed. And if for some reason you cannot afford your medicine, please reach out to the American Heart and Stroke Association. We have some incredible programs that can get you your medication for free or very low cost. Exercise, my friends. Everyone's always talking about what's this magic pill? How am I going to control my numbers? How am I going to look better, feel better, sleep better, manage stress? Exercise is that magic pill, magic bullet. I don't care what you want to call it, but it is incredibly important. You heard me talking earlier about, throwing hay. My YMCA closed during COVID, but I continued to be able to stay active. I walk my dogs on a regular basis. We walk after dinner. We throw bales of hay. We clean out the barn stalls, whatever it takes. I remember when I first moved out here, he would be like, oh, let's take the truck to see my mom. She's like a block away. I'm like, we are never driving over there. We are walking. We walk in rain, sleet, hail, sunshine. We walk. So finding ways to incorporate extra steps, take the stairs instead of the elevator or the escalator, right? Take that furthest parking spot. Those steps and those extra calories that you're burning are really adding up in a beautiful way. And then, of course, not a lot of people talk about this, but your dental health is very important. A lot of cardiologists will speak to your dental health as being really the gateway to your heart health. So making sure that you're seeing a dentist on a regular basis, brushing your teeth, flossing, having that important dental work done, and always being very transparent about any heart medications you're on before you have that dental work done as well is very important. Next slide, please. So I love preventative maintenance, right? I would rather be proactive than reactive when it comes to my heart and brain health. Particularly when I see the number of people and the quality of life that people have after a stroke or a heart attack, if they even survive. So getting plenty of rest, right? We would love to see you getting an average of 7 to 8 hours of sleep a night, if possible, on a very consistent sleep schedule, even on the weekends. And I know that is hard to do as we age gracefully, but there's even power in those, what I call power naps, right? If you can just sneak a 30-minute nap, there's some great research about the power of a power nap and how important sleep is to our heart and brain health. So we know, of course, that losing sleep can never be made up. Over time, that sleep deprivation can have a very negative effect on our long. Next slide, please. And of course, we talked here about dental care. Bacterial endocarditis is basically like a germ, right? For lack of a better way, to travel through your bloodstream to your heart. It's very dangerous. There are some heart patients that have to be on special medications before they are having dental treatments done. So again, if you are currently under the care of a cardiologist, a cardiovascular surgeon, or a neurologist, make sure that your dentist is aware of that before they begin specific procedures in their office. Next page, please. So overall, we want you to take care of you. We recognize that many of you are caregivers, especially now during the pandemic, whether you're caring for someone in your family, whether you're caring for a neighbor. We are really good oftentimes of looking out for others, but not always making sure that we look out for us, right? So what are those warning signs? Do you know your family history? Are you managing your numbers, your blood pressure, your cholesterol, your BMI, your fasting glucose? Are you understanding what they mean? And if not, visit our website at heart.org, HEART.org, or talk with your family physician. Take a list of questions with you. We hear from so many people, they got white coat syndrome before they went to the doctor, or they got into the doctor's office and they wait so long, they forgot what questions they had. So before you even leave your house in the morning for your doctor's appointment, write your questions down on a piece of paper, stick them in your wallet or your purse, and when you get into the waiting room, when you finally get to see the doctor that you've been waiting to see, pull out your list and review that with them. It's important that they know your family history and that you ask them those questions that are so important to your heart and brain health. Watching our weight, right? It's really hard to do, but a good balance, a very colorful plate during the week. If you want to have a cheat day on the weekend, go for it, as long as you're managing your numbers through diet, lifestyle, and medication therapy. And as long as you're getting your physical activity in, we do recommend 30 minutes of physical activity a day. And our new research says that breaking that up into 15-minute segments has as many health benefits as doing it all at once. So take some time for you. Do what I do. I actually put it right on my calendar like I would a doctor's appointment, a dentist appointment, right? Put it right on your calendar so that you are held accountable to getting those steps in, and get up and move. Especially if you're working from home right now, try to get up and move at least once an hour. We want you to try to exercise daily. You heard us talking about that, incorporating steps, using equipment. Go out and embrace this beautiful winter weather. If you're, a snow bunny like me, I love to snowboard, I love to snowshoe, cross-country ski. You can burn some amazing calories, get all that fresh air, come home and sleep like a baby. No caffeine. No caffeine. Yeah, I wish no caffeine. No smoking, right? So we don't want you to vape. We don't want you to use cigarettes. We don't want you to use e-cigarettes. And we certainly don't want you using chewing tobacco. If you need some resources on how to quit, I have some amazing references and resources for you. And I will say, talk to your children and your grandchildren about vaping and e-cigarettes. Adult smoking in this country in some areas is down as much as 40%. So big tobacco has gotten really clever with how they're marketing e-cigarettes and vaping to our children, our next generation of their, I like to call victims. So please, please, please do your homework on e-cigarettes and vaping, understand what the mechanisms are. And the Heart Association has even created a video from the kids, for the kids right here in Erie. We did it at Strong Vincent Middle School. We have a 5th, 6th, and 7th grader that created this amazing video that we would love to share. And then, of course, always listen to your doctor's advice. When you heard earlier about the readmission rates through heart failure, it's because people have the best intentions and they get back home and they fall into the same routines, or there are other factors in their life that prevent them from following their doctor's instructions. It's really important that you own your heart and brain health. So we want you to think about something that you can do, one nugget from today. Maybe it's getting more sleep. Maybe it's knowing what your numbers mean and looking those up at the heart.org website to find out if you're in line. We do have a free assessment called My Life Check. You can punch your numbers in there and find out how you score and how to improve your numbers in the coming months. And then find creative and healthy ways to manage your stress, right? Being mindful that we all manage stress a little bit differently. There are different types of stress: financial, relationships, work-related. I could go on, right? But we have to find creative ways to manage our stress. And part of that is just having a positive outlook in life. I'm sure you've heard this from your friends at Blue Zones, but really waking up in the morning and being grateful and appreciative for something in your life, right? Everyone has something to be grateful for. I wake up in the morning and I jot down, as I'm drinking my hot cup of green tea, 3 things that I'm so grateful for. There is some research to actually putting it on paper and looking at it rather than just thinking it through. And I like to keep my little sticky notes of all the things that I'm grateful for. And it's funny and it's interesting because certain times of year, I'm grateful for different things. So it isn't always the same things that come to mind. Certain days I may be more grateful than others, for having to shovel that poo in the barn. Next slide, please. So here we are with knowing the warning signs of heart attack and stroke, right? Always, of course, always call 911 in the event of an emergency. Never try to drive yourself, never drive a friend, family, coworker, a neighbor to the hospital. And there are some really important reasons for that. Obviously, if you or your loved one were to have a major event in the vehicle, it could put everyone else at risk. And also the first responders that will come and come to you and transport you to the hospital have some incredible devices on the ambulances that will save your heart and brain and really improve your chances of recovery. and surviving a cardiac or brain event. And of course, we want you to empower the medical professionals. So wear your medical tag. If you have a condition such as diabetes, wear that so that your healthcare professionals can treat you accordingly and most effectively in the event of an emergency. Next slide, please. So before we conclude, if we could real quickly just review the heart attack signs for women and men, as well as for stroke. So first, we're going to go over the classic movie star symptoms of a heart attack. And that is that crushing chest pain, that elephant or that ton of bricks on my chest, crushing pressure that would come and go. That is a warning sign of a heart attack in both men and women. Mainly men are experiencing these symptoms. Many of our female survivors didn't have that typical chest pressure, but we need to be aware of it because it has presented that way in some women as well. That pain that resonates up and down one or both arms into the neck and the jaw area, that achiness, again, a symptom in both men and women. Oftentimes, men experience that more than women, but that's definitely a sign of a heart attack. That sweatiness, nausea, and pure exhaustion, that fatigue is really a key indicator, but also that sweating and that nausea as well. Something that I've heard from a lot of the female survivors is these are the warning signs that present in women more often. And it's a little scary, right? Because it feels like something that you would feel when you're coming down with like the flu per se. So I don't want you to think every time you're getting the flu that you need to call 911, but I want you to think about the big picture. Women, do you know your family history? You know, do you have a strong family history of heart disease and stroke? Secondly, do you know your numbers and are you managing them? Your blood pressure, cholesterol, your BMI, and your fasting glucose. If you are managing your numbers, right, and you know your family history, you've had regular conversations with your doctors, you're getting your sleep, you're managing your stress, you're eating, you're exercising, then more likely you're having, maybe a flu. If you're not managing your numbers, if you really aren't even on medication, maybe you don't even know what your numbers are, and you've got that strong family history, perhaps you've got a parent or a sibling, right, or a grandparent that passed at a young age, you definitely need to act fast. And don't ever be ashamed of calling 911 and going to the hospital. Don't use, your fear or the fear of a bill showing up in the mailbox as a reason to not potentially save your life. There are a lot of people that care about you. So it's better to come home and say, you know what, it was a false alarm, than to never be able to have that conversation with anyone again. It's serious stuff, my friends, and that's why we're here today to talk about it. We are losing far too many women. You might have seen our campaign is one is too many, and that's a new slogan that we're using, but it really hits home for me because I lost a good friend and coworker at the age of 34 to misdiagnosed heart disease. So 34, no one should ever die at 34 years old. So please listen to your body. Don't ignore your warning signs. Take action, see your doctor, take your medication, get that exercise, right? Manage your stress, avoid tobacco, and, take your best friend for a walk. I don't know if your best friend is a dog or someone in your family, or, you've got a great girlfriend or guy friend that you enjoy spending time with, but please get out and get some physical activity. It will do your heart a world of good. As you can see here on the page, we've got some great resources at heart.org, stroke.org, or our GoRedForWomen.org website. Tons and tons and tons of valuable resources, recipes, food label reading, the My Life Check Heart Score. I know the Go Red for Women this month, they do some fun giveaways. There is so much. So many tools and resources for you, your family, and your friends. So think about one thing that you heard today. You know, I'm not expecting you to do everything we talked about. It can be a little overwhelming, but perhaps there is one thing that you can do. Cut back on sodium, go to bed a little earlier tonight, you know, do a little yoga or meditation, get some extra steps in this week. Think about that one thing, and you don't have to share, but that you will do for you, because there's a lot of people that care about you, and we want you here. We want you here for a very long time. So thank you so much. Does anyone have any questions for me?
Gina, I have a question.
Hi, Kathy. I saw your name there. Hello, friend.
Well, hello. How are you?
I'm doing great.
So I took my picture off. But you had mentioned blood pressure, and I've had high blood pressure when I worked. When I retired, it dropped so low that the doctor took me off of the medication, but I still take my blood pressure. But the interesting thing I've never heard of is, I think you said 3 things: feet on the floor.
Yep.
And no talking. Was there more?
Yeah, so there is more, and I've got information that I can share with Shannon and Jen that they can send out to the team. It's like a kind of a cool infographic, and it has a woman, and it applies to men too, but I like it because it's a woman and Go Red Month, right? So it's got a woman sitting in a chair with those cute little bubbles around, and it's kind of our new best practices. So blood pressure, the procedure of taking blood pressures is all over the board. And when we started our check, change, control program a few years ago, we recognized that there were no consistent best practices. And so numbers, right, were so all over the board for results. And so some people were on medication that didn't need to be on medication, and some people weren't getting medication that needed it. So we started to really own this best practice space. And I will tell you, there's, I think, 4 things that are really easy to remember, right? So when you go to the doctor, every time I go, my feet are dangling off of an exam bed, right? When they take my blood pressure, you need to be in the visitor's chair or the doctor's chair there next to the exam table, sitting in that chair with your feet firmly on the ground. And I'm going to explain all of the reasonings behind these things after I finish. The second one is having an empty bladder, right? So using the restroom, or if you need to give a urine sample, doing it before you get your blood pressure. The third one is no conversation during the blood pressure. And I did notice that when I went to the OBGYN a few months ago, my nurse was a little chatty Kathy, and she was just being friendly, right? No, excuse the pun with Kathy, but she was very, very friendly, right, with me. And I thought, oh, this poor girl, hasn't seen our new best practices. So she got a little bit of an education in the nicest way, of course. And then the fourth thing is to not be physically exerted. I'll give you a great example. We did a blood pressure session at Friendship Baptist Church. And as you can imagine, a Baptist church is a very lively group. And then they ran up the stairs right after their sermon, and they sat down, and everyone in the entire church had high blood pressure because they were so physically excited. And then to top it all off, they ran up the stairs so they could be the first ones to get their blood pressure done because they wanted to go home after church. It was lunchtime. And everyone in the entire congregation had high blood pressure. So we really, truly want you to be still for at least 5 minutes. So all of those things that I mentioned ensure a more accurate reading, and I'll send a cute little infographic to the girls, but they ensure a more accurate reading so that when you're working with your doctor, you're either getting on the medication you need to be on, or you're, coming off of medication perhaps that you don't need, because all of those things, and there's a few more other ones in the infographic, are indicators that can make your numbers go one way or the other. So this is everything that we do is based on science, right? We have the best and the brightest scientists in the world that we fund through, our events like Heart Balls and Heart Walks and Go Red events. And we make sure that before we release any recommendations, it's all tried and true. And those are all tried and true examples of how to get a more accurate reading. So I suspect that we have a program called Target Blood Pressure, and that's on the healthcare side. And as you can imagine with COVID, everyone's been a little bit distracted, so they haven't received their trainings yet. It hasn't kind of trickled down to the provider level, but you'll be hearing more about that in the near future. But great question, and I'm glad that your numbers are under control.
Thanks. I heard once, and the doctor told me too, once you have high blood pressure, you're susceptible to it. Even if it goes down, it could come back. So
yeah, I mean, keep an eye on it. As we age gracefully, our numbers are harder to control across the board, right? You can have outstanding, and I hear it all the time, I had the best blood pressure and then I hit, 60 or 50 or whatever that, and certainly, sadly, the poor ladies, once we hit that change of life, we also, our numbers and our protection from heart disease goes away as well. So certainly as we're going through things like menopause, we have to be extra careful and extra adamant about the decisions we make, particularly with seeing a healthcare professional. It's shocking how many people don't go to a doctor on a regular basis. So yeah, just having, the power of the physician and the latest tools and research technology and medication therapy, as you know, is changing at the light of speed right now. Things like precision medicine are really going to make a life-saving difference. So it's such an exciting time for all of us to be alive, but we want to keep it that way, right? We want to be alive and we want to be active and, we want to be vibrant. And so sort of that's the goal, right? I always tell my friends to be able to enjoy retirement, right? Like you are, right, Kathy?
You're right. I am.
Aren't you blessed? But so nice to see you. You look fantastic.
Oh, thanks. Thank you.
Any other questions?
I had one.
Yes. Hi.
I wanted to ask, you had shared that there is a site you could go to get your specific numbers and see, where you're at. Can you share that website again?
Oh my gosh, yeah. So you see the first, I don't know if you can see the screen, it says heart.org. If you go to heart.org and then in the search engine, Tricia, type My Life Check. Okay. And that health assessment will come up and it's completely free. You do need a little bit of information. You need to know your numbers, which of course we encourage. But if you don't know your numbers, you can say, I don't know, and it'll still give you a score, a heart score, and advice on how to improve your score. But if you do have your numbers, it's an even more powerful tool.
Okay.
Thank you for asking. You're welcome. Great questions. Anybody else? Well, thank you all so much. It's been such a pleasure to be here, especially during Heart Month. We love our friends Shannon and Jen, and we love the Blue Zones. It's such an incredible project. We're so honored to be able to be a partner in your community.
Thank you shared so much, a wealth of information. Thank you.
Yeah, isn't she good?
She sure is.
Really appreciate it.
I love you guys. I've only been doing this for a minute. It'll be 35 years in August.
Wow.
So I feel truly blessed. I think, yeah, it was, that was my calling in life. But I'll tell you what really jolted me, girls, is when I lost my coworker in the year 2000. She was only 34. And I'll tell you, she hadn't had a chance to get married or have babies or buy a house, all the things she used to dream about with me every day in our small little office. She died on my birthday, and I'll never forget it. And she's the reason I get out of bed every morning and really, really feel passionate about what I do because, I owe it to her, and no woman ever should lose her life at 34 years old. She was seeing a physician and they just weren't recognizing it as heart disease because she was a young woman. And so they were diagnosing her with everything else. I mean, they had her they thought she was depressed, she had anxiety, they thought she had these breathing disorders, and here she was literally in heart failure. And she passed away. And so, you know, I dedicate my work, my life work to her. You would have loved her. She was a joy. Karen Ryle. She was from Wesleyville.
Wow.
All right, ladies. Well, thank you. Do one kind thing for your heart, please. Have a good day.
All right,
Thank you.
Thank you.
Take care.
Take care. Bye-bye.
Bye. Wow, that was very good, Shannon.
Yeah, that was good. And she has shared that powerful testimony about her good friend previously. That's a real shame. But yeah, Gina's got a great passion for the work that she does, and we certainly appreciate it.
We do.
Yeah.
Well, everyone have a good day and be safe.
Yeah, yeah.
Hey, Shannon, I was just thinking those three websites she listed. Are you going to post those on the Facebook? Those three that she listed there at the end?
Oh, sure. I'd be happy to.
.org, stroke.org, and then the Go Red Women, like for more resources, check out.
Yep, absolutely.
Or you can wait till next week when you do the video links too. I mean, I just thought it'd be a nice touch to put those.
Yeah, I might share them today though, because I might share, you know, what's the one thing you're going to do good for yourself?
Okay.
Do something kind for yourself. Hi, Sue. How are you? You're muted, dear. You're on mute, Sue. She's like, okay, hold on a minute. I'm going to get it.
We'll talk to you all later. Hopefully I'll see you all at 6 o'clock.
Jennifer, I'm going to head out here soon, so I'll probably miss you, but I will certainly at 5 o'clock, and then I'll be on for Debbie's presentation at 6.
Okay.
Sounds great.
Yep,
Thank you very much. It was a great
Okay,
presentation.
Awesome. Thank you. Thank you,
Bye-bye.
Cynthia, for being here.
Bye-bye.
Bye-bye.